The Winchester Health Department would like to provide you with information concerning the COVID-19 pandemic. If you are 60 years of age or older, you are considered high risk for severe illness from coronavirus COVID-19. Coronavirus is a respiratory illness that can spread from person to person. If someone over 60 contracts coronavirus, they are at higher risk of complications, hospitalization, and in some cases death. You need to take extra precautions now to minimize your exposure. People who have serious underlying medical conditions like heart disease, diabetes, kidney disease, and lung disease are also at higher risk. Here's what you can do. Stay home as much as possible and keep away from others who are sick. Wash your hands often. Clean and disinfect frequently touched surfaces. Limit close contact with others, not closer than 6 feet, about 2 arms length. Talk to your pharmacy about obtaining extra prescribed medications to have on hand, or consider using a mail order service. Be prepared. Have over-the-counter medicines and supplies to treat fever and other symptoms. Have enough household items and groceries on hand. Consider having groceries delivered by the store or by family or friends. Have someone check on you and stay in touch with others by phone or email. If you live alone and become sick, you may need help. There are many people and resources in town to help support you. If you do not have someone to check in on you, if you have trouble accessing food, or if you have other questions or concerns, please reach out. Call the Jenks Center at 781-721-7136. Contact Town Hall at 781-721-7133. Dial 211 for non-emergency situations. It's free, confidential, and multilingual. You may also call the Interface Mental Health Referral Service at 888-244-6843. This service will match residents in need with mental health providers based on individual needs. It's a resource for outpatient services, not crisis support. Telephone counseling is definitely possible. A list of COVID-19 frequently asked questions for Winchester seniors. Question 1. What is the best way for me to get up-to-date information on COVID-19? The answer? If you have access to a computer or smartphone with internet, here are some helpful resources. The town of Winchester has a dedicated coronavirus page. You can access that one at winchester.us/coronavirus. The AARP have free resources targeted toward people 65 and older. Check their website at aarp.org. The Centers for Disease Control have many resources. cdc.gov. The state government has resources and updated statistics available at mass.gov. If you don't have internet access, you can call the Jenks Center at 781-721-7136. You can dial 211 for non-emergency questions. You can contact Town Hall at 781-721-7133 or contact the Interface Mental Health Referral Service at 888-244-6843. Question: why are so many things in Winchester closed? The answer? In order to prevent the spread of COVID-19, the state government has ordered the closure of restaurants and bars. As of now, you may still order takeout food. Ordering by phone or online is highly recommended. In Winchester, we have our own restrictions to protect our residents due to the higher number of cases in this region. This includes social distancing, and is why businesses like hair and nail salons and gyms can no longer be open during this time. Question: what is social distancing? The answer? Social distancing means remaining 6 feet or more apart from anyone outside of your household. The best way to assess whether or not you should engage in activity in any setting is to ask, can I maintain a safe distance from others? If the answer is no, the recommendation is not to do it. Here are a few things that the Winchester Health Department recommends. First, no in-person socializing outside of immediate household members unless for medical or home health-related support. For those with grandchildren, visits are especially not recommended because children may not have symptoms but could be carrying the coronavirus and get you sick. Second, when contact is required with others for essential purposes, for example buying groceries, medicines, or necessary supplies, attempt to stay at least 6 feet away from others. If you're outside for recreation, like walking or hiking, try to stay at least 6 feet away from others. Question: how can I protect myself and others from getting sick during this time? The answer: wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. You should avoid touching your eyes, nose, and mouth with unwashed hands. Cover your cough or sneeze with a tissue, then throw that tissue directly in the trash. Question: is it safe to go to the grocery store or pharmacy? The answer: if you're over the age of 60 or have a compromised immune system, think about getting your groceries and other necessary supplies delivered or picked up by a family member or friend. You should avoid a direct handoff. Arrange to have the items delivered to your doorstep or placed nearby instead. You can tip electronically. One benefit of ordering deliveries online or via an app is that you don't have to hand the delivery person money. Opportunities to tip the delivery person are included in most of the delivery apps and online ordering systems. You should also consider ordering earlier than you usually do. Though it's not a safety issue, you may find that in the midst of higher demand, you may have to wait longer. If you need to go to the grocery store, stay 6 feet away from other people. Take hand sanitizer with you. Use it on your hands before and after you shop. Use a credit or debit card. That way, you don't have to hand over bills or receive change. Also, use your own pen to sign receipts. Many stores now have special hours for seniors at the start of their regular opening hours. For example, Stop & Shop in Winchester is open to seniors only from 6 to 7 a.m. daily. Whole Foods in Woburn is open to seniors 8 to 9 a.m. daily, and Market Basket in Burlington's senior hours are 5:30 to 7 every day. Question: how can I best take care of my mental health during this time? The answer: you should take breaks from watching, reading, or listening to news stories and social media. Hearing about the pandemic repeatedly can be upsetting. Try to take care of your body. Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and avoid alcohol and drugs. Make time to unwind. Try to do some other activities you enjoy. Connect remotely with others. Talk with people you trust about your concerns and how you're feeling. If stress gets in the way of your daily activities for several days in a row, consider reaching out to a therapist. You can call Interface at 888-244-6843. Question: what are symptoms of COVID-19? Signs and symptoms of COVID-19 may appear 2 to 14 days after exposure and can include fever, cough, and shortness of breath. Other symptoms can include fatigue, aches, runny nose, and sore throat. If you have these symptoms, call your primary care doctor. And if your symptoms worsen, call 911 if you are experiencing a medical emergency. While we don't know how long this challenging situation will last, we do know that we are part of a caring and supportive town and community that is here to help you.